The Maternal Child Health section in the Georgia Department of Public Health has a wide variety of responsibilities. We really are focused on improving the health outcomes for women, children, and fathers and families in the state of Georgia. And so we're looking at what are the conditions in Georgia that are impacting families, and how do we improve upon those conditions so we can improve health outcomes. When we looked at our data with regards to infant mortality, we wanted to understand where were babies dying and why were babies dying. So first thing we did in looking at the data is to understand where the rates were highest across the state. We had a state average and we wanted to compare that to pockets of the state where the average was much higher than the state average. Once we identified where the problem was, we knew that we wanted to have some targeted interventions in those specific communities. At that point, we had to figure out, well, why were infants dying in these communities? So we really had to look at what were the risk factors for not only the infant, but also for the mother who delivered an infant that eventually died, and what was going on with them.
We became a department 4 years ago, and when we became a department, we decided there were certain important things that we wanted to try and do, and the infant mortality was number one. For decades, we had been in the bottom of the infant mortality rankings. When we decided that infant mortality was a priority in the state, we brought together our coalitions, both our statewide coalitions and our national coalitions, and we made dramatic improvement. We'd been in the 40s as far as state health rankings for decades. Last year, we moved from a ranking of 44 to a ranking of 34. And this year, we've moved up to a ranking of 31.
We had been looking at our data for birth outcomes, infant mortality, preterm birth rates, and was just struck by the disparate birth outcomes. And once I learned about centering and the impact of centering, then that really sold me on the idea of bringing centering to Albany. The centering model has made a huge difference within our community. The numbers are preliminary, but when we look at the data of our centering patients in preterm birth rates, it's about half the rate of our baseline preterm birth rate. The centering model empowers women by making sure that they are a part of their care. They chart different goals they have for their pregnancy, and so they're just very much involved in their care.
I learned about the bathing. I had no idea how to bathe the baby, what to do, how to change a diaper, but with this program, it helped me figure out all that.
Yes, I would recommend this program. They made me feel welcome, and they took any worries that I had away.
The Baby Luv program was initiated in 2008 with a grant from March of Dimes to implement a program to serve high-risk African American pregnant women. We partner with the community to emphasize the Baby Luv program by partnering with places such as the Wiregrass Technical College in their dental program, Bank of America, the local churches, and the local OBGYNs and the local hospitals in order to promote healthy birth outcomes. At the home visits that we conduct, we encourage their families to be there. We encourage their significant others to be there so that they can be a part of the pregnancy as well. For example, we always engage the fathers so that they can assist and encourage the client to breastfeed, how to hold the baby during breastfeeding, and just how to promote that bonding. By seeing our infant mortality rate going down in Lowndes County, it's simply breathtaking. It's such an amazing feeling to know that we impact the infant mortality rate in Lowndes County, but most of all, seeing that we provide education and intensive home case management to improve healthy birth outcomes of those clients that have high risk factors. The reason we do what we do is to serve our community and our clients.
It gives the young mothers and fathers an opportunity to receive education and outreach that will help increase the health of their young one and hopefully save lives.
My opinion of Baby Luv is this is the best program that Valdosta has because it don't just center around the mother, but it also have different things for the fathers to come that we can learn that can help us assist the mothers better with the birthing of our child.
The future for the Maternal Child Health section in the Georgia Department of Public Health couldn't be brighter. We have so much work that we've done We've made such tremendous progress in the area of infant mortality. We really look at the needs of our community in order to build our strategies for the future. And what's so exciting is we're not doing this work alone. We have tremendous support from our partners, and we're able to leverage each other's strengths to make a difference here in Georgia. And by making a difference here in Georgia, it impacts the states around us and impacts the entire nation, because we all learn from each other. And I think there's a tremendously bright future for the citizens of Georgia, and by having those healthy Georgians, we're going to have a healthy United States.